Managing anxiety is a complex and deeply personal journey that many people face in today's fast-paced and high-pressure world. Anxiety manifests in different ways, from generalized anxiety disorder to specific phobias, social anxiety, and panic disorders, each presenting unique challenges that affect both the mind and body. At its core, anxiety is the body's natural response to stress, but when the response becomes overwhelming and persistent, it can interfere with daily life. To understand how to manage anxiety, it's essential to recognize the many factors that contribute to it, including biological predispositions, environmental stresses, and psychological patterns. The World Health Organization reports that nearly 4% of the global population suffers from anxiety disorders, making it one of the most prevalent mental health conditions. Prominent psychologists, including Dr. Martin Seligman, the father of positive psychology, have long studied the ways anxiety can affect individuals, leading to both emotional and physical health issues. Dr. Seligman's work emphasizes the importance of resilience and optimism in combating the negative effects of anxiety. He states, "The belief that things will get better is a key component to mental well-being. This belief, or lack thereof, plays a significant role in how people experience and manage anxiety." One of the leading scientific approaches to managing anxiety is cognitive behavioral therapy, which has been widely supported by evidence as a highly effective treatment. According to the Journal of Anxiety Disorders, CBT focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety. CBT therapists guide patients in challenging irrational fears, helping them reframe their thinking to create more realistic and balanced perspectives. For example, Sarah, a 32-year-old teacher, struggled with social anxiety for years, often fearing she would embarrass herself in front of others. Through CBT, Sarah learned to recognize the cognitive distortions fueling her anxiety, such as catastrophizing or mind reading, and she replaced these thoughts with more rational ones. After several months of therapy, Sarah found that her anxiety lessened significantly, allowing her to interact with colleagues and students with greater confidence. CBT's success in reducing anxiety is backed by numerous studies, including a 2018 meta-analysis published in Clinical Psychology Review, which found that over 75% of patients with anxiety disorders experienced significant symptom relief after undergoing CBT. Another essential tool in managing anxiety is mindfulness, a practice rooted in ancient meditation traditions but widely adopted in modern psychology. Mindfulness involves bringing one's attention to the present moment, cultivating awareness and acceptance of thoughts and feelings without judgment. Jon Kabat-Zinn, a leading figure in the field of mindfulness-based stress reduction, defines mindfulness as paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. This practice has been shown to reduce anxiety by helping individuals detach from their anxious thoughts rather than becoming entangled in them. A 2019 study published in the Journal of Clinical Psychology found that participants who practiced mindfulness meditation for 8 weeks experienced a significant decrease in anxiety symptoms compared to those in the control group. Jane, a 28-year-old lawyer, incorporated mindfulness meditation into her daily routine after years of battling chronic anxiety related to work stress. By practicing mindfulness for just 10 minutes each morning, Jane noticed a shift in her ability to handle stressful situations more calmly and with greater clarity. Physical activity is another crucial element in managing anxiety. Exercise is known to release endorphins, the body's natural mood lifters, which can counteract the effects of stress hormones like cortisol. Studies have consistently shown that individuals who engage in regular physical activity are less likely to experience anxiety. For example, a 2017 study published in the American Journal of Psychiatry found that people who exercised for at least 30 minutes a day were 30% less likely to develop an anxiety disorder over the next 3 years. Mark, a 40-year-old entrepreneur, used running as a way to manage his anxiety after facing financial difficulties in his business. By incorporating daily runs into his schedule, Mark found that not only did his physical health improve, but his mental health benefited as well. The rhythmic nature of running allowed him to clear his mind, and the endorphin release helped alleviate his anxious thoughts. In addition to exercise and mindfulness, social support plays a vital role in managing anxiety. Humans are inherently social creatures, and having a supportive network can make a significant difference in how one copes with anxiety. A 2018 study in the Journal of Affective Disorders found that individuals with strong social support were less likely to develop anxiety and depression. Social connections provide a sense of belonging and safety, which are critical when facing stressful situations. Take, for instance, Emily, a college student who struggled with panic attacks. After confiding in her friends and family about her anxiety, Emily found that their support made her feel less alone and more equipped to handle her symptoms. Her friends encouraged her to seek professional help, and they regularly checked in on her, offering both emotional and practical support. While lifestyle changes such as mindfulness, exercise, and social support are effective for many, some individuals may require medication to manage their anxiety. Selective serotonin reuptake inhibitors such as Prozac and Zoloft are commonly prescribed for anxiety disorders and have been shown to be highly effective. A 2019 study in the Journal of Clinical Psychiatry found that SSRIs significantly reduced anxiety symptoms in over 60% of patients within 3 months of treatment. However, medication is not without its drawbacks. Many individuals experience side effects such as fatigue, weight gain, or sexual dysfunction, and finding the right medication often involves a trial and error process. It's important for individuals to work closely with their healthcare providers to determine the best treatment plan for their specific needs. Diet also plays an important role in managing anxiety. A 2020 study published in the Journal of Psychiatric Research found that individuals who followed a diet high in processed foods, sugar and caffeine were more likely to experience anxiety. In contrast, those who consumed a balanced diet rich in whole grains, fruits, vegetables and omega-3 fatty acids were less likely to suffer from anxiety disorders. Omega-3 fatty acids in particular have been shown to reduce inflammation in the brain, which can help improve mood and reduce anxiety. Foods such as salmon, walnuts and flax seeds are excellent sources of omega-3s. For John, a 35-year-old graphic designer, changing his diet had a noticeable impact on his anxiety levels. By cutting back on caffeine and incorporating more whole foods into his meals, John found that his energy levels stabilized and his anxiety became more manageable. Sleep is another critical factor in managing anxiety. Poor sleep and anxiety often go hand in hand, creating a vicious cycle where anxiety disrupts sleep and lack of sleep exacerbates anxiety. A 2018 study in the Journal of Sleep Research found that individuals who experienced chronic insomnia were 5 times more likely to develop an anxiety disorder. To improve sleep quality, experts recommend establishing a consistent bedtime routine, avoiding caffeine and electronic devices before bed, and creating a calming sleep environment. For Sarah, the marketing executive who struggled with chronic anxiety, improving her sleep hygiene made a significant difference in how she managed her anxiety. By sticking to a regular sleep schedule and creating a relaxing bedtime routine that included reading and deep breathing exercises, Sarah found that her anxiety symptoms became less intense. In addition to these strategies, it's important to address the underlying thoughts and beliefs that fuel anxiety. Perfectionism, for example, is a common trait among individuals with anxiety disorders. The constant pressure to be perfect can lead to feelings of inadequacy and fear of failure, both of which contribute to anxiety. As Brené Brown, a research professor and author, explains, perfectionism is a 20-ton shield that we carry around hoping it will protect us, when in fact it's the thing that's really preventing us from taking flight. By letting go of the need to be perfect and embracing the idea that it's okay to make mistakes, individuals can reduce their anxiety and lead a more fulfilling life. For Mark, the entrepreneur, learning to accept that not every business decision would be perfect was a turning point in his journey to managing anxiety. By adopting a growth mindset and viewing challenges as opportunities for learning rather than failures, Mark was able to approach his work with a greater sense of calm and confidence. Journaling is another effective technique for managing anxiety. Writing down thoughts and feelings allows individuals to process their emotions and gain clarity on the issues that are causing them stress. A 2017 study published in Psychosomatic Medicine found that expressive writing reduced anxiety symptoms in individuals with high levels of stress. For Emily, journaling became a daily practice that helped her manage her social anxiety. By writing down her thoughts each morning, Emily was able to identify the negative beliefs that were fueling her anxiety and replace them with more positive and empowering thoughts. Managing anxiety is a lifelong process that requires a combination of strategies tailored to each individual's unique needs. Whether through therapy, mindfulness, exercise, social support, medication, diet, or lifestyle changes, there are numerous tools available to help individuals regain control over their anxiety. It's important to remember that anxiety is a normal part of life, and experiencing it does not make one weak or flawed. As Glenn Close, an advocate for mental health awareness, once said, "What mental health needs is more sunlight, more candor, and more unashamed conversation." By bringing anxiety out of the shadows and into the light, we can reduce its stigma and help individuals feel empowered to seek the support they need. With the right tools and support, anxiety can be managed, and individuals can live fulfilling, meaningful lives free from the constraints of chronic worry. Thank you for sticking around till the end. If you found this discussion insightful, make sure to like, comment, and subscribe for more deep dives into human behavior.